Hello, Samarty. You don't look well. That cough has been with you for days now. How long has it been?
Oh, I had this cough long before I came here. I don't know what it is. I feel so tired.
You should go and tell the Tibetan doctor to arrange for you to get tested for TB, tuberculosis. It's a very simple test. You just have to give a sample of that green stuff you are coughing out. The most important thing you need for TB is anti-TB medicines. They are the only medicines that get rid of tuberculosis. They use them all over the world. You will stop carrying that cough with you, and in no time, you will beat me climbing the mountain. You'll see.
Morning. Welcome to my clinic. I am Amshi Yeshi. What can I do for you?
Oh, I've had this cough day and night for several weeks. I cough up yellow-green phlegm. I feel so tired. I can't do much during the day. Sister told me to come to you because she thinks I might have tuberculosis.
Do you have fever and sweats in the night time?
Yes, although it's cold in the room, I sweat a lot. I think it's a stubborn cold gone wrong. I picked it up somewhere.
Have you lost your appetite as well?
Yes, I'm never hungry.
Let's see. Are you getting thin?
Yes. How do you know all that?
Well, those are the common symptoms of TB. Look, you can see it in this little film.
Yes, I have all of that. You know about TB. Could you give me Tibetan medicine?
Well, sadly, Tibetan medicine will not cure TB. It can only make you feel better. To get rid of TB, you need to take anti-TB pills as well. If you have TB and don't take anti-TB medicines, then the TB gets stronger and stronger and could even kill you. Taking anti-TB medicines also quickly stops a person with TB passing it to other people. So, I can give you both types of medicine.
You say I can pass it on to others. So what is TB then?
Let's go for a walk, and I will tell you about it.
So you said I can pass it to others, but how does that happen?
Okay. Tuberculosis is produced by a bacteria. It has been in the world for centuries, but is still very common today. The bacteria is tiny. You can't see it with your naked eye, You need to look through a microscope. The last time we went to the hospital, the Rinpoche was able to see the TB bacteria. A third of the people in the world are infected with TB. And here is the cause. A tiny bacteria called Mycobacterium tuberculosis. But does that mean a third of the world's population are sick? Fortunately not. Only a small number actually become sick. Let's look more closely to see why. This is someone who is sick with TB. When they cough, they expel little bits of saliva which fly into the air. Some of them may contain the tiny TB bacteria. The bacteria can then pass to someone close by and go into that person's lungs. That person is then infected with TB. But they do not necessarily become sick. The body sends out its defense cells, or white cells. These swallow the bacteria and take them to places in the body where they can be locked up, where they will not cause harm. Here, the bacteria go to sleep, sometimes for years, so the person can have TB in their body, but they do not get sick as long as their defenses stay strong. So why do some people become sick? Sometimes the defense system is not strong enough. The TB bacteria multiply too quickly, so the defense cells cannot catch them all, and the person becomes sick. Babies and small children are especially at risk. You can get sick if the sleeping TB wakes up and escapes. These can happen months or years later if a person's immune system becomes weak, due to other illnesses, malnutrition, or because they are very old and weak already. The TB germs can go to other parts of the body, to the bones and joints, stomach, head, liver, and the heart. So this is our infected person. He is coughing up phlegm which has TB germs in it. He is likely to be losing weight. He will probably have fevers and night sweats. If he has these symptoms, he needs to go to see a doctor who can give him medicines to cure him of TB. This is the important thing. TB is curable. So, we need you to do a test to see if you have TB.
My friend told me you can discover if I have TB by looking at my green phlegm.
She is right. The test is very simple. We collect a sample of sputum, not saliva, but phlegm from deep down in the lungs. The sample is taken to a lab to be analyzed under a microscope. And that is how we can tell if you have TB. Let's watch this little film on how to produce a good sample of sputum, and then you can try producing yours.
Hello. You have been asked to get your sputum tested to find out if you have TB. If you find out that you have TB, don't worry. TB can be cured, but only if you complete your full course of medication. If you don't get properly treated, you can pass on the disease to others when you cough, spit, talk, laugh, or sneeze. TB is caused by bacteria that usually affect the lungs. Sputum, or phlegm, from your lungs can show if you have TB, so it's important that you cough up a good sample of sputum to test. This is sputum. It can be thick, slimy, or even runny. It might look yellow, grey, or greenish. And if there is blood in the sputum, it might look brown or red. This is not sputum. This is saliva, which comes from your mouth. It looks clear and watery. To find out if you have TB, we need sputum from your lungs, not saliva from your mouth. Following these simple instructions will help you cough up sputum from deep in your lungs. Make sure to go to a place away from other people. Outside is best, or indoors next to an open window. This will ensure you do not spread TB to others. If you have food or something else in your mouth, rinse well with clean water. To cough up sputum from your lungs, first relax. Then breathe in and out deeply 3 times. Next, take a deep breath and cough hard to bring up sputum from deep down in your chest. Drop the sputum into the cup. Be careful that no sputum gets on the outside of the container. You need to cough up enough sputum to cover the bottom of the container. If you are unable to cough up enough sputum in one go, try again. When there is enough sputum in the container, put the lid on tightly. Hand the sputum container back for testing straight away. You may find that you are unable to cough up much sputum, even after several tries. If that happens, you can try coughing up sputum at home. Sputum collects in your lungs while you sleep, so it may be easier to cough it up first thing in the morning as soon as you wake. Inhaling steam can also help to loosen up sputum in your lungs, making it easier to cough it up. Wherever you are, the technique for coughing up sputum is the same. Relax. Breathe in and out deeply 3 times. And cough forcibly from your chest. When there is enough sputum in the container, put the lid on tightly. Return the sputum sample to the testing centre, the same day if possible. If you have any questions or need some help, don't hesitate to ask a health worker. And remember, even if you don't have TB, you can help others who have a cough by encouraging them to be tested. Thank you for your best effort.
Now, Sumati, it's your turn to try it. Hello, Sumati. The results of your test have come back from the lab. Please, come in. They show that you have active TB. But not to worry, TB is curable. You take medicines for at least 6 months. It's very important that you take your pills every day. It can be difficult taking medicines for the first month. Sometimes they can make you feel a bit sick, but you must keep going, and with time it will get easier. If you stop, it is very dangerous. The TB will get stronger and the medicines will no longer work.
One of the other nuns told me that if I am not careful, I could give everyone else TB. I could make them sick. It might even kill them. I don't want to do that. What should I do?
Yes, it is true that you can give other people TB. That is why you must take medicines. After 2 to 4 weeks of taking the medicines, you will not be contagious anymore. In the meantime, there are things you can do to prevent giving TB to others. While you still have a cough and during the first 2 weeks of taking your medicine, it is a good idea to wear a mask to protect other people, especially children and the elderly. They can catch TB very easily. Whenever you cough or sneeze, you should cover your mouth with a piece of cloth. If you don't have one, you can also use your sleeve or arm, like this. But even more important, do not spit indoors. The TB germs inside any house can live for a long time in the dark. If you must spit, do it outside, as sunlight helps to kill the TB germs. I also want to warn you not to be put off by seeing your pee turn orange. One of the medicines you will be taking does that. Also, it is normal to have flu-like symptoms for a while. It is your body dealing with the unwanted TB bacteria.
Is there anything else I can do to make myself feel better?
Yes, there is. You have to take the anti-TB medicines for 6 months. You will find the first 2 months the hardest because you have to take more medicines. During that time, you need to do everything you can to make you stronger. You need a good diet. Adequate nutrition with plenty of protein like yak meat, curd and cheese is important. You also need lots of vegetables. Make sure you have iodized salt. How are you greens doing in the polytunnels?
They're doing well. They might need weeding now.
Finally, I will also give you some Tibetan medicine. This will not cure the TB, but it will help you to get strong. Good. You remember to go to the window to cough. Remember to let in as much light as possible. TB doesn't like light.
You're looking better, Sumati.
It's good that my TB was traced early enough. Yeshi has been looking after me. She reminds me that taking all my medicines is the compassionate way.
Yes, it's being mindful, alert to look after each other.
A couple of new nuns arrived yesterday, one of them coughing badly, like me. I've already suggested that she goes to see Dr. Yeshi for testing, just as you did for me when I was very sick.
Have you finished the treatment yet?
No, not yet. I have to go and visit Yeshi tomorrow. She said I need to do a 2-month test. Then I think she said I have to take more anti-TB medicines. I don't really want to. And I feel better now. I will ask her tomorrow.
Ah, there's Sumati. Hello, dear. How are you feeling today?
I feel much better now. Thank you. I know you said I have to take 6 months of medicines, but could I stop now?
No, I'm afraid that you have to keep taking your medicines for a full 6 months. This is very important. Although you feel better now, you will still have some TB inside you. If you don't complete the treatment, it will grow again and the TB will come back stronger. It will be able to resist the medicines, so the treatment may not work. This is called drug resistance, and it is very dangerous. You could become ill again and pass to other people resistant TB, which is difficult to treat.
But I remember you said the next months would be easier.
Yes, they will. The good news is that you don't have to take as many medicines for the next 4 months. You get them from the hospital and they are for free.
And then I will be cured?
Yes, I am happy that you are looking much better. When you finish the medicines, you should be cured. By the way, thank you for sending to me the new nun who you saw coughing. I have sent her to be tested for TB. It is what we must do. We need to look after each other. Did you find it helpful that I reminded you every day to take your medicines?
Yes, it was very useful. Otherwise I can forget.
It is important for us to have a system in our community to keep a list of everyone with TB and everyone who is on treatment. We need to know when they will need more medicines. We also need a way to remind them to take them. I know how difficult it can be to remember. It's something that is hard for me to do alone. Is that something you would like to help me with? Because you have been taking the medicines and are getting better, you could help to encourage others. The ENG doctors said that in other parts of the world, you will now be called an expert patient. You understand about TB very well because you had it. And in turn, you can help others. Nice tea, Sumati. Thank you.
Thank you. I have nearly finished my treatment now. It feels good to have done it properly. I have been talking with others like you asked me and helping them take their medicines. I have been telling my relatives and their friends about TB and how to prevent it. Last week, I went back to visit my family. One of my nieces was coughing quite badly. She has 2 children to look after. And one of them has a cough as well. I think they might have TB. There is a clinic near where they live. So I told her that she should have gone there already. Otherwise, both she and her children could get very sick. She's promised to go now. I also told them how to prevent the spread of TB. How it is important to cover their mouth with a cloth or arm when they cough or sneeze. And when indoors, always to do it by a window or door. Not to spit inside a house, rooms or tents, even if it has a dirt floor. That TB can be passed from person to person. And there are other illnesses that can be passed in the same way. Hygiene is really important. Keeping the place we live in clean and aired and allowing daylight to come in is a simple but effective way of preventing the spread of bacteria. I have to keep reminding them not to spit inside the house. Put food away from rats and dogs. Since animal saliva carries illnesses, And I told them to remember not to throw garbage. To pick it up and bury it in a pit. And very importantly, always take your medicines.
It is true, Sumati. You said it well. We have to be compassionate to ourselves. And we also have to be compassionate to the earth we walk on. It is the mindful way.